ACL injuries are probably one of the most common things we see as orthopedic sports medicine physicians. The ACL is the main stabilizing ligament of the knee for sports participation. It stabilizes the knee both in an anterior to posterior direction, but also in rotation. So any kind of planning, cutting, start-stop sport, your ACL is active. It's providing you stability while you're doing those things. The injury is quite common. It usually occurs when a patient plants or cuts. Sometimes it can be from a direct blow to the knee, say in a football game, when a helmet hits the knee to a planted extremity and forces it inward. The injury can be quite painful, especially if it's a contact injury, like in a football game. Often people will say they hear a pop or they felt a pop. They have immediate discomfort, and they'll develop fairly significant swelling pretty quickly. And then there are non-contact ACL injuries that occur. For instance, a soccer player could be running, they plant their foot in the ground to change direction, and they'll hear that pop, they'll feel that immediate pain, they'll develop that swelling fairly quickly. Rarely will a patient, say, play a sport and come in and say, I was just running and I felt a pop, but it didn't really hurt that much. That's definitely more common in a non-contact injury. But the pain is usually pretty significant for 24 to 48 hours because of the swelling that's developing. As the swelling subsides, the pain often will go down. There can be other associated injuries with an ACL tear, and so if you have injured something else, such as another ligament or maybe your meniscus, sometimes that'll prolong your pain.